Welcome back, everyone. I'm Samantha here with SM NCLEX Reviews. Today, let's quickly review a commonly tested topic, Abraham Maslow's hierarchy of needs. Do you remember what this is? This psychological theory helps to explain human behavior and motivations. People need to meet their more basic human needs like food and shelter before seeking out those more intricate needs. Understanding this theory will help you not only on your NCLEX exam, which is right around the corner, but also in your nursing practice. Let's say you have a full load of clients on your shift and you need to decide and prioritize who to tend to first. Now, I know this can be daunting, but understanding Maslow's hierarchy of needs can help you nail down your prioritization skills. The main idea of Maslow's hierarchy of needs is that each level of this pyramid needs to be fulfilled before moving up to the next level. And here's a quick visual of that pyramid. So let's quickly run through each level. Starting at the bottom of this slide, in the bottom of the pyramid, we have physiological needs like air, water, food, sleep. Think things you need to live. Also think of this as like our ABCs in nursing, right? Airway, breathing, circulation. We can't move up our pyramid if our client isn't breathing. Let's say we've met those most basic needs, so now we can move up to our next one, which is safety and security. These are still pretty basic, but still more on the nice to have side than the bottom, that more fundamental part of our pyramid. This would be a personal sense of security, employment, resources, even good health. A quick nursing example is, does our client feel safe within our care? Are they trusting us as caregivers? And are we ensuring that they have a safe environment in which we are preventing falls and other injuries? Moving up our pyramid again, once an individual feels safe and taken care of, they can begin to pursue love and belonging. Think of this as a sense of closeness, friendship, intimacy with others, feeling connected, even listened to. This is a safety net or support system for our clients. Now, are we advocating for our client? Do they trust that we will speak up for them? Do they feel isolated while within the hospital? Once a client feels love and belonging, their needs can then move to, again, a higher level. The next level on the pyramid is esteem. So for this one, think dignity, independence, feeling respected and strong. Do they feel worthy? A quick example here would be instilling a sense of independence and dignity in a client with a newly placed ileostomy bag. Teaching them to take care of their ostomy in a dignified manner would help meet this level of need. Finally, after all of those levels have been met, we then have self-actualization at the top. That is the highest level one can achieve. Self-actualization is an individual realizing their highest and fullest potential in terms of their creative, social, intellectual, even spiritual self. All of these other needs need to be fulfilled before we can be the best versions of ourselves. And for our clients, when we've helped them meet those needs, they can look at helping others and bettering the world around them. And that is the peak, my friends. So, how does this apply to nursing care? Let's do a quick practice question. A 68-year-old client is admitted to the unit status post left total nephrectomy. The registered nurse notes inappropriate urine output for the past 3 hours on shift. The registered nurse notifies the provider of this finding. This is an example of which level of need according to Maslow's hierarchy of needs. Is it A, love and belonging, B, physiological, C, safety, or D, esteem? Go ahead and pause if you need to, then press play and jump back in when you're ready. So the correct answer here is actually B, physiological. Input, output, and elimination are among those most basic needs a human should fulfill in order to stay alive. These are physiological functions. This type of need is the highest priority as a registered nurse, as we need a minimum of 30 milliliters of urine output an hour to be considered adequate and safe for our client's kidney status function. Since that wasn't met, we definitely need to address this issue. And before we close out, I wanted to leave you here with somewhat a silly little mnemonic to help you remember the order of Maslow's hierarchy of needs. So this goofy way to think about it but it's going to help stick in your mind so you remember it. So, purple spaceships, love embarking to Saturn. That's going to stand for P, physiological, S, safety and security, L for love and belonging, E for esteem, and S for self-actualization. Now, if you're a visual learner, definitely try to envision this spaceship and cute little alien when you're trying to remember that order of hierarchy of needs. So there you have it, the absolute basic need to know information about Maslow's hierarchy of needs. When you're a real deal registered nurse here real soon, you're going to find that all your clients have a lot of needs. And who do you tend to first? Who do you call the provider for first? Maslow's hierarchy of needs seeks to help you prioritize your actions and is especially important when you have multiple clients to juggle. Want to dive deeper into this topic? Make sure you check out our crash course where we work through more practice questions on this topic, as well as dive into a little bit more in depth of things and on a lot more topics as well. Thanks for joining me and happy studying.